I felt like I was screaming from the top of the mountains and no one could hear me.
And I really thought he was going to die.
He was afraid to find out just what it was.
Next, two medical mysteries that defied the experts. Jerry O'Meara suffered in silence for years with embarrassing symptoms, but when his vision started to deteriorate, it was too much for him to bear alone.
I couldn't take it anymore. I wanted my eyes back again.
And Samantha Edgar, a child whose only hope was a mother who wouldn't give up.
I would be ding-danged if I was going to let her die, and I didn't, die right along with her trying.
When Samantha was born, she was healthy but small and was admitted to the neonatal intensive care unit.
My thoughts were, oh, well, okay, so this is just kind of, we're going to check off the boxes. She's going to be all right and she's going to go home.
I think it was about day 3, her pediatrician called me and said, we've noticed that Sam has had high blood pressure, which is unheard of nearly in newborns. And then I started noticing when I went into the NICU to nurse her that her face was getting bigger, or had gotten a lot bigger. She was real jowly, like a chipmunk. The nurses kept saying, oh, look at those chubby cheeks. I just love those cheeks. I want to grab those cheeks. And I'm thinking, that is not normal. There's something wrong with these cheeks. She got to the point where she couldn't nurse. She couldn't latch onto the breast. So I was pumping milk, and then I would have to sit her up and hold her cheeks up and feed her with a bottle because her cheeks were so immense.
She was only eating about an ounce of breast milk an hour. And she was real kind of floppy when you would hold her. It was, I don't want to say creepy, but it was a little bit creepy for me holding her because she didn't seem right.
After 18 days of testing, doctors couldn't find a reason for the high blood pressure.
Just trying to hold nails, pound nails. All of a sudden, my hands would just cramp up, and I'd have to stop and kind of work the fingers and work them loose again.
Jerry's fingers would start to swell up, and we didn't know why. He couldn't move his fingers, and his joints were sore.
I just thought it was arthritis. A lot of people get arthritis. I didn't go to the doctor. I figured that I could take care of it myself.
For the next 3 years, Jerry's pain persists and gradually begins to spread throughout his body.
It got down into my legs, and there's times the back of my legs were so painful that I just could not walk.
It was terrible. I would have to put the compresses hot and cold. I would massage them. It would take forever to get rid of the pain.
I would take 8, 10, maybe even 12 pills a day to relieve the pain.
Then, Samantha was moved to Seattle Children's Hospital, where only the most serious cases are sent.
We saw about 50 doctors, residents, interns in the first couple hours that we were there because they don't see a lot of babies with high blood pressure. So they did every test under the sun.
2 weeks passed, and the doctors were still stumped. Whatever was causing Sam's bizarre symptoms was a complete mystery. She was given blood pressure medication and sent home.
The doctors were saying things that ran across a whole range of possible diagnoses. The one that I thought made the most sense at the time was that she was simply born too early, and by the time she actually reaches her due date, her original due date, that some of this would resolve.
We weren't getting any answers as to why our baby was so sick. It was a terrible feeling. It really was. It was a terrible feeling. I'm thinking she was about 5 or 6 weeks old, and she really didn't seem to be getting any better. I said, she's just so non-responsive. She's like carrying a dead baby around. I mean, it's just dead weight. It's not right.
But within a few weeks, Sam started to get better. Her cheeks lost their puffiness, and Jackie and Bill tried weaning her off the blood pressure medications, which they thought might have been causing some of the listlessness.
And lo and behold, her blood pressure numbers didn't go up at all. In fact, they continued to go down until she reached a normal level.
And it was like a light went on with this baby. There was a remarkable change in her appearance where she started to look like a baby, and she actually started looking like a cute baby. She was gaining weight slowly. She was growing slowly, but she was good. We thought everything was okay.
When Jerry turns 55, suddenly he's stricken with devastating stomach problems.
I would eat, and then it'd just start going straight through me. I wouldn't retain the food or anything.
Then he started losing a lot of weight, a lot, fast. You could see the bones and the veins in his arms. His legs were like bird legs.
When I'd look myself in the mirror, I'd see my ribs sticking out, and I thought, man, I don't even want to look at this.
Over the next 2 months, Jerry drops almost 40 pounds. But he's so embarrassed about his symptoms that he refuses to talk to anyone about them, not even a doctor.
I more or less kept it to myself. To me, it would be embarrassing to talk about.
He's a proud man. I'm sure that had a lot to do with it.
I thought, I'll just take care of it myself and just keep my mouth shut.
I think Jerry was really scared, and he was afraid to find out just what it was or how bad it was.
Linda would keep telling me to go to the doctor, and I'd keep telling her that I wasn't gonna go.
It got so bad that I couldn't take him sitting and whining and crying on the couch day after day after day, because it was affecting me. It was making me a nervous wreck, and I just couldn't handle it anymore.
We just started having arguments back and forth, and it was just a breakdown in the marriage.
It caused us to get a divorce. I didn't know what to do anymore for him. I couldn't help him. He didn't want help. Jerry just wanted to be left alone. So I left him alone.
For the next 20 months, Samantha seemed like a perfectly healthy child. Then, practically overnight, she started to change.
It started with this ferocious appetite. She would ask me for, she didn't talk very much then, but she would ask me for num-num, 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 and this was a child who never really ate.
She would just shovel food into her mouth, and then she would complain that she was hungry again.
She started getting up at night, and she would get up every hour, and she'd be soaked. She had urine from, her neck down to her toes, front and back. And it was about then that I noticed the swelling coming back in the face and the redness, and then a little acne on her forehead, and her eyebrows started growing together.
She gained over 10 pounds in maybe a little over a week, and wasn't our little girl anymore.
She would look in the mirror and she'd say, "Who's that?" It was kind of sad because she didn't recognize herself.
A lot of people were thinking, oh, she just grows, she's really going through a growth spurt. And I remember thinking at that time, this isn't a growth spurt.
Well, I took my children to Las Vegas, and we were gone about 10 days. Samantha was perfectly normal and fine when I left. When I came back, I pulled up to Jackie's, and Samantha came running out to the porch to meet me, and there she was in this little dress. She had tights on, just stuffed into the tights like little sausages. And I remember Jackie had a T-shirt on from the Taco Bell, and it had the little Chihuahua dog, and there was a taco next to it, and Sammy kept going, yum, 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 trying to eat the taco.
Tina walked up the steps, and she said, "What happened to her?" She looks sick again. She looks like she did when she was a newborn. So I thought, this is the same thing. It's come back.
For the past 6 years, Jerry O'Meara has been plagued with horrific joint pain and severe stomach problems. His mysterious illness has taken over his life and ruined his marriage. After his divorce in 2001, things only get worse for Jerry when suddenly his eyesight starts to fail.
Reading the newspaper or anything was getting blurry. I noticed that things in a distance, I couldn't hardly make them out.
Despite these symptoms, Jerry still refuses to see a doctor.
Jerry called me up and told me he would go to the drugstore and buy heavy reading glasses to see if it would help, but it just kept getting worse.
He was not working because his eyesight wouldn't let him, and he was just not capable of taking care of himself.
Jerry finally makes an appointment with an optometrist who prescribes stronger lenses. But after just a few days, his vision gets even worse.
People would walk in and they'd say hi, and I'd look at them and I'd say, well, who the heck are you? I couldn't recognize anybody. All I could make out was a silhouette of the person.
If we'd be sitting in the kitchen, we would say, what time is it? I cannot read this. So we'd have to tell him what time it was. Reading the paper, impossible. Watching TV, impossible.
Afraid he might be losing his eyesight, he makes an appointment with ophthalmologist Dr. John Kitchens.
I remember when I first saw Jerry, he was kind of slouched over. He was a tall gentleman, but very thin, almost frail looking at that point. You almost had to drag answers out of him when he just was very stoic. And you could tell there was something wrong with him.
I went in and Dr. Kitchens looked at my eyes the first time. He was bound and determined to find out what this was.
Dr. Kitchens notices a problem immediately. The interiors of Jerry's eyes are inflamed.
Dr. Kitchen took pictures of my eyes from inside out to every which way you can imagine. I've had so many bright lights shined in my eyes that it started hurting.
Generally, when you see inflammation within the eyes, it can be from an infection such as syphilis. There's tuberculosis, which can be from an inflammatory condition such as sarcoidosis. So we tested him for all of those things early on with both labs and imaging with x-rays and whatnot.
Dr. Kitchen's main concern, he was not going to give up until he had a solid answer.
But while waiting for the answer from Dr. Kitchens, Jerry's eyesight deteriorates even further.
I'd be walking down the street and I had a hard time seeing the sidewalk that was under me. That was the scary part. I thought I was going to go blind.
He couldn't navigate the key in the lock because it was just too blurry a vision for him, and it kind of freaked him out.
I was at the point where I couldn't take it anymore. The stress and the anguish, I wanted my eyes back again.
Jerry rushes back to Dr. Kitchens' office. When he arrives, Dr. Tom Oeding, the head of the eye clinic, immediately takes Jerry into an exam room.
Jerry's not the sort of fellow that complains a lot. And so the fact that he came in to this non-scheduled appointment is telling us with as much force as I think Jerry could that he was concerned and having trouble.
Dr. Oeding performs a thorough examination of Jerry's eyes.
He had had a significant loss of vision, and he wasn't even able to see the largest letter on our chart.
It was just a grayed out area. I couldn't see nothing.
And at that point, we knew that we had to turn up the heat on figuring out what was going on with Jerry.
When all the tests come back negative, the doctors are baffled. The only diagnosis they can think of is terrifying.
It was obvious that the inflammation was getting worse, that his condition was getting worse. That's when we started to think maybe this was the intraocular lymphoma.
Intraocular lymphoma is a rare type of cancer that starts in the eyes and quickly spreads to the brain.
And if it is lymphoma, there's nothing they can do.
Jackie's pediatrician suspected that Sam's symptoms were being caused by a hormonal imbalance, so he referred Samantha to an endocrinologist. But they had to wait 5 weeks for an appointment, and Sam, now 2 years old, was getting worse.
She was in a lot of pain. She'd say, my back hurts, my feet hurt, my head hurts, you know.
When Samantha eventually saw an endocrinologist, he tested her for a rare genetic disorder that causes chronic hunger. The results wouldn't be ready for over a month. In the meantime, Jackie was sent to a nutritionist.
So the nutritionist said, she said that we needed to decrease her salt intake, decrease her snack foods, give her rye crisp if she wants, you know, fishy crackers, that kind of thing. And I'm afraid I wasn't very nice to her. I actually, at one point, said, you know, this isn't about Cheetos. She's sick. She's sick, and they don't know what it is.
They didn't understand that. I think they saw Jackie as an aggressive, almost bitchy mom with this fat kid who had a fat kid and was wondering why her kid was fat.
5 weeks later, the tests came back negative. Whatever Sam had, it was not a genetic disorder.
And at that point, for about a week prior to the test coming back, Sam just stopped eating. And she started sleeping through the night.
Her appetite diminished, her face started to get a little bit thinner, she slowly dropped the weight.
She went back to exactly how she was before.
And I was still just hoping that this was some bizarre thing that happened and maybe we were done with this whole mess.
But I always had in the back of my head that there was something in her, something just waiting, lying in wait.
9 months later, Samantha's illness struck again.
Jackie would call me on the cell phone. She wet the bed last night. She's starting to eat a whole lot.
As Sam's condition deteriorated, Jackie was told she'd have to wait to see another endocrinologist.
I said, you need to take her down there. There's something wrong with her. You need to park yourself down there and do not leave. I said, you're going to have to play the crazy card.
I think we were there for about 3.5 or 4 hours, and then they paged us to see him.
They pretty much said, we've seen this before. We've been here. Yeah, we know that she gets these little things, but I don't think it's anything.
I did, I guess, understand right then that he wasn't going to be able to help me.
I remember the look in her face, and she was, saying, nobody's doing anything. He just thinks she's just a fat, greasy kid. He thinks I'm nuts and hysterical, and I don't know what to do.
I felt like I was screaming from the top of the mountains and no one could hear me. And then I started doubting my own sanity, thinking, am I making a mountain out of a molehill? Is this the way my child grows? Does she eat and eat and eat? But I knew in my heart, there's something wrong.
For Jackie Edgar, the joy of raising her daughter Samantha has been marred by the fear and uncertainty caused by a mysterious disease Samantha has had since she was born. In 2001, the 3-year-old seemed to be getting better, but then it started all over again.
For the past 6 years, 59-year-old Jerry O'Meara has been quietly suffering from inexplicable joint pain and stomach problems. But when his vision starts deteriorating rapidly, he seeks help. His ophthalmologists fear that he may have a rare form of eye cancer, and that the answer may have come too late to save his eyesight or his life.
Intraocular lymphoma typically has a very poor prognosis, so it's something that we all had hoped Jerry wouldn't have.
Jerry undergoes an MRI, which comes back negative for intraocular lymphoma. But an MRI can't always detect this type of cancer. A more definitive test is an eye biopsy. Although it's risky, the doctors have no other choice.
He just began to look worse and worse, and I really thought he was going to die.
The depression state started setting in really good then. I was scared that it's just a matter of time that I'm going to rot away.
Jerry was always scared. He wouldn't show it, but you could see it in his eyes.
Got a call from the resident in the emergency room who said he had a patient, 3-year-old girl, who had been referred in by her primary care physician for glucose in the urine, which is usually associated with diabetes. But he went on to say that the story is more complicated. So I decided to go down to the ER and check it out.
I saw a man in a white coat come walking down the hall, kind of striding down the hall, I remember, and I said, well, look at him, Bill. What do you bet he's an endocrinologist?
In fact, I think she used the word a dumbass endocrinologist. And that was sort of her attitude at our first meeting.
Jackie, I think, already had made the assumption that this was going to be another endocrinologist that was going to come in and send us down, a whole range of tests, poke holes in our daughter again, to no, successful diagnosis.
I was ready to go to battle with him, and he just nodded. He said, I'm sorry you've had such a hard time with this. This is a puzzle. This is such a mystery, and it's a fascinating case. And he was exactly what I needed. So I just started talking to him a mile a minute, and he actually sat down and looked at her pictures and looked at her.
She was a little overweight, but she was not morbidly obese. She had a look that reminded me of Cushing's syndrome.
Cushing's syndrome is a potentially deadly malfunctioning of the adrenal glands. These glands make hormones that are vital for development and managing stress. But Cushing's causes them to produce too much of the hormone cortisol, leading to weight gain, excessive hair growth, hypertension, bone loss, and muscle damage.
And I told her right then and there I wanted to get an ultrasound of her adrenals and see if we could find a tumor. So we did that, and that was negative. And then I told her the main thing we wanted to do was a 24-hour cortisol level, which is sort of the definitive test for Cushing's syndrome.
Oh, Jackie was so relieved. She found her hero. He cared. I remember her coming home from her appointment and saying, somebody cares. He actually cares.
But in the days before the procedure, Dr. Kitchens makes a discovery that he thinks might change everything.
I never really questioned the diagnosis of lymphoma. We were all kind of going along with that plan to proceed with the vitreous biopsy. And I happened to be in our library, and I read a book on inflammation in the eye, and one of the authors of the book went on to a description of Whipple's disease.
Whipple's is an extremely rare infectious disease caused by the bacteria Tropharema whippleyi that is found in the soil of some warm climate areas. The Whipple's bacteria first attacks the joints, eyes, and intestines. Left untreated, it can spread to the lungs, heart, and brain, and can be fatal.
But I thought, boy, you know, this really fits with Jerry, but I don't know that he has the gastrointestinal manifestations of the Whipple's disease.
Yet Whipple's affects only 2 in a million patients, and Dr. Kitchens' colleagues think the young doctor may be fooling himself.
My first reaction to John was, you know, you've been reading too much. Forget about these rare diagnoses and maybe go home, go to sleep. Because it just didn't make sense that we would be the one case in the whole world this year that was going to have a Whipple's.
A week later, Jackie and Sam were back at Dr. Gunther's office to see how the cortisol level test had come out. The results were frightening.
The cortisol level was in the neighborhood of 3,000 nanograms per 24 hours. To put that in perspective, normal is less than about 15. So this was close to 500 times the normal amount of cortisol. So at that point, I knew what, but I didn't know how, and I didn't know why.
The elevated levels of cortisol proved that Sam had Cushing's syndrome. But the puzzle was far from complete. Cushing's is extremely rare, and no one had ever heard of it occurring in someone as young as Samantha. Dr. Gunther admitted Sam to the hospital to find out why she was producing these astronomical levels of cortisol. But privately, Gunther told Jackie there was another reason for admitting Sam.
He said to me that he had spoken to some colleagues and he had spoken to some people, and that he was concerned because there was mention around Children's Hospital of Munchausen by proxy.
Munchausen by proxy is simply when a caregiver, usually the mother, is deliberately making the child sick, usually for the attention, presumably, that she garners from the attention that's lavished on her daughter or on her son.
I was so startled. I said, Munchausen? I said, what? Who would do that? I wasn't really getting it until I finally went to my sister and Val, and they said, well, they think that you're doing it. They think that you're making Sam sick.
You've got to remember, what we're seeing here is a picture, apparently, of a girl who's being exposed to high doses of hydrocortisone for very brief periods of time, separated by periods of greater than a year, 10 months, 6 months.
I said, you know, you're crazy. You're the one that's crazy. You know, why would you think that? He said, well, I don't think you have Munchausen.
She just did not fit the bill of Munchausen at all. These, and they're almost always women, are usually very ingratiating with the medical establishment. You can say a lot of things about Mrs. Edgar and her relationship with the medical establishment, but ingratiating would not be one of the descriptions.
But Dr. Kitchens is convinced he's onto something. He suspects that Jerry might not have told him about certain embarrassing symptoms. Now he needs all the facts.
Jerry came back in, and we asked him if he was having any stomach issues. And initially he said, no, everything's fine. Then, after more persistent questioning, he told us, I've had this diarrhea for 3 years.
The more we listened to Jerry, the more we listened to Dr. Kitchens, the more sense it made. The doctors order an endoscopy and a small bowel biopsy to test for Whipple's.
I remember I was in clinic seeing patients, and I got a phone call from the gastroenterologist. And he said, we just got Jerry's biopsy results, and I've got to hand it to you guys down there in the eye clinic. It's Whipple's disease.
I was absolutely elated. I was surprised. I was excited. I thought it was one of the most interesting things that I'd heard in years.
It's not like the lymphoma that's going to be fatal. It's something that can be treated, and Jerry can get better.
All I knew is the man said, we can cure this. And I was one happy fella.
He was very happy in his own Jerry stoic sort of way.
The treatment is astoundingly simple. An antibiotic, which Jerry takes twice a day.
So here we went from thinking that Jerry had this horrible cancer to just giving him some antibiotics.
The relief is immediate.
When I started taking antibiotics, I could start feeling my stomach pain and pressure within about 2 weeks, starting to subside. Things were getting better. The diarrhea's gone, the weight's coming back, my eyesight's good.
And it meant a whole new life for Jerry, basically.
If not for his doctor's persistence, Jerry O'Meara might not be alive today. Whipple's disease is a complicated diagnosis to make.
Whipple's disease is difficult because it involves many systems. And so it involves your stomach, it involves your central nervous system, your joints, your eyes. And oftentimes you'll go see separate doctors. You might not think that they're related. You might not tell the eye doctor that you're having stomach problems or vice versa.
If Jerry hadn't been diagnosed at the time that he had, I believe that this probably was progressing into the later stages of Whipple's disease and could have become fatal in Jerry's case.
Dr. Gunther knew that Sam was being exposed to too much cortisol, but now he had to prove that it was Samantha's own body and not her mother that was causing it.
I told her we need to do some tests in a supervised environment because we have to take this off the table. Otherwise, it's always going to be in the room.
After 4 days of testing, Gunther got the results he had hoped for. It was Samantha's own body, and not her mother, that was inducing the high levels of cortisol. The Munchausen by proxy suspicion was dropped. But Gunther was still no closer to solving the mystery.
So the outcome was that this was real. It was Cushing's syndrome, and that it appeared to be cyclical. It appeared to be coming and going like the flu, and I had no explanation for how or why that could be happening.
Daughter Samantha is suffering from a rare and potentially deadly illness, Cushing's disease. Now, Jackie and her doctor, Dan Gunther, need to find out how to cure it.
So I hit the books and did quite a bit of research.
Acting more like a detective than a doctor, Gunther discovered a physician at the National Institutes of Health who was studying Cushing's syndrome.
And so we bundled her off eventually to Maryland, to the NIH.
After 10 days of testing, Gunther's determination paid off. The doctors found that Samantha's adrenal glands were covered with microscopic nodules that were causing them to overproduce cortisol. The only hope for a cure was to remove the glands.
Fortunately, if you remove the adrenal glands, we can replace all of these hormones. And as long as they're replaced, you pretty much can function perfectly well without your adrenal glands.
On April 8th, she had the surgery. I'm thinking it was about 4 or 5 hours, and it was really virtually the fastest 4 or 5 hours of my life. I sat there and I read a magazine and I drank coffee, and I think it went like that.
But a couple of days, and she was up and talking and reading and watching television. That was such a joyful moment for us because it was like, okay, you know, she's really going to be fine. She's tough. She made it through.
Sam's wonderful. Sam's like a whole new girl. It's been almost 1.5 years since surgery, and it's like we got a new kid a 1.5 years ago.
A single operation has transformed Samantha's life. But the operation might never have happened if it weren't for Jackie's persistence and Dr. Gunther's determination.
It's the same in medicine as anything else. The squeaky wheel gets the grease. Mrs. Edgar is a ferocious advocate for her child, and there's no doubt that helped Sam's cause.
And if someone doesn't give you an answer, they'll see someone else and go and go and go and knock on doors and sit in waiting rooms and find out till you're satisfied, till finally you're at peace with yourself and you've known that you've done.
But now, 5 years since his diagnosis, Jerry is 65 and doing great.
He's going to be on long-term therapy, and he will be monitored long-term to make sure that this doesn't recur. But Jerry has an excellent prognosis.
Jerry's back to his happy-go-lucky self. I can't live with him, and I can't live without him. He'll always be in my life.
I went from dang near being dead to having a new life and just start getting on with the second chance, I guess.